So let's do croup. This is going to be part 1. What is croup? Croup is actually a swelling around the larynx or vocal cords down into the larger airways in young children from certain viruses. That swelling occurs from the virus and causes everything to come in, and it makes it harder for the child to breathe. They also have a little bit of spasming of the airways. So they have this kind of cough. They also have what we call stridor, where when they're breathing in and out, you can actually hear the noise like if it's just at rest, that is a lot more concerning. If it's when they're playing around, but it stops when they're resting, it's a little bit less concerning. So that's what croup is. The main causes are from RSV, parainfluenza, influenza, and the COVID-19 variant Omicron. It's now been added as one of the top 4 causes of croup in children. The most common age is going to be 6 months to 3 years, but it can occur after that. This is a common time of year as a lot of those viruses are getting going. Right now, we're seeing parainfluenza in the Northeast, but RSV is on its way. Influenza and COVID-19 will also be on its way as well. So these are some quick things that you can do if your child wakes up with that cough in the middle of the night. The first thing you want to do is open up the freezer door, stand in front of it with your child. That cold burst of air will sometimes calm down the spasming and allow that stridor to calm down. The second thing you want to do is go into the bathroom, turn on a steamy shower, really heat up that bathroom and let it steam up. The steam can moisturize the airways, decrease some of the swelling, and decrease some of that spasming and help your child breathe more comfortably. The next thing you want to do if it's not getting better, as you're on the phone with your primary care, you want to be in the car with the air blowing as much as you can in their face, obviously with them in a car seat and safely restrained, driving to your local emergency room, urgent care, or primary care office, because at that point they're likely going to need more medical treatment. If you get there and your child is completely fine, still check in. We used to say wait for half an hour to an hour and you could go back home, but there's a lot more evidence that if the symptoms get bad enough to get you to emergency care, they probably need further medical help. So this is going to be part 1. We'll do part 2 and part 3.